Hello everybody, welcome to the next lecture in our aesthetics series. Today we'll be talking about dermaplaning. So what is dermaplaning? It's essentially exfoliation. It's a manual physical exfoliation procedure that removes dead corneocytes from your stratum corneum, peach fuzz, surface debris, and superficial keratin plugs. Unlike chemical peels or lasers, it causes minimal epidermal injury and essentially no thermal damage. It is a superficial cosmetic procedure. So we have to look at the anatomy of our skin. We have our outermost layer, our epidermis, which contains our stratum corneum, lucidum, granulosum, spinosum, and basal layer. Only the outermost stratum corneum is removed in the procedure. That's the part that has your dry skin, basically. Your dermis contains collagen, elastin, fibroblasts, vessels, follicles, and glands, and should never be reached, i.e., if there's bleeding, you've gone too deep. So, normally corneocytes shed every more or less 28 days, once a month, in young adults. In aging skin, it takes longer. The dead cells can accumulate and lead to a duller complexion, rougher texture, reduced product penetration and efficacy, and uneven pigmentation. Dermaplaning basically just accelerates removal. One concern people have is that, quote unquote, shaving causes the hair to grow back thicker and darker. Dermaplaning does not do that because it does not change vellus hair into terminal hairs. Terminal hairs are dark, coarse, and hormone dependent, whereas vellus hairs are fine, soft, light colored hairs. Terminal hairs would be things like eyebrows, mustache, beard line. The superficial peach fuzz on your cheeks is not the same thing. So what is the mechanism of action? The blade removes dirt, sebum, hair, surface oils, and keratinocytes, which cause the skin to appear more smooth and have improved cosmesis, basically. It causes mild epidermal injury for cytokine release, leading to epidermal renewal, and minimal collagen induction, unlike microneedling, but a little bit of a benefit there. So what are your indications for dermaplaning? Is dull skin, dry skin, fine lines, very mild acne scarring, hyperkeratosis, photoaging, and people who want immediate results prior to events. Additionally, it is useful to be used before things like microneedling, facials, chemical peels, and LED therapy because it helps improve those results even more. So what are your contraindications? Open wounds, herpes simplex infection, cellulitis, acne, especially bacterial acne, suspicious pigmented lesions, and uncontrolled rosacea. Relative contraindications are things like inflammatory acne, eczema and psoriasis, recent isotretinoin use, i.e. Accutane, thin skin because it's more likely then that you will reach the epidermis, poor wound healing is a relative contraindication, and as well as bleeding disorders and anticoagulation. So what equipment do you need? Well, you need a handle and you need a blade. Your blades come in 10, 10R or 14, as well as a 15. The most common ones used though are the 10R and the 14 because of their more rounded tips. You need gloves, an antiseptic cleanser to cleanse your work area, as well as gauze, and SPF and moisturizer for post-treatment. So pre-treatment, get a medical history, previous procedures and complications, any medications the patient is using, as well as inflammatory conditions, history of cold sores, such a thing. Check for active inflammation and lesions, as well as the skin type. Then you take photography of the area, as well as consent. Patient ideally needs to stop retinoids and the similar drugs 2 to 3 days at least prior, and stop photosensitizing drugs at least 2 weeks prior. And ideally not have makeup on the day. Remove it the day before, or even avoid it the day before completely. So how do we measure skin types? We look at a thing called the Fitzpatrick scale. Dermaplaning is suitable for all types, but higher types, i.e. darker skin, has an increased risk of post-inflammatory hyperpigmentation. Yeah, basically. So, how do you do the procedure? Step one, you prep your area. You cleanse, well, introduce yourself, wash your hands, put on gloves. Cleanse the area, remove the oil with your skin prep, degrease with alcohol or acetone, and remove makeup if the patient came with it. Then stretch the skin and have it nice and tight to prevent the blade from catching and cutting. Keep the blade angle at approximately 45 degrees, and you should have light gliding pressure, not scraping. Do short strokes, move top to bottom, avoid eyelids, avoid lips, and avoid any sort of raised lesions. Avoid repeated aggressive passes because it can cause more irritation. Post-treatment, clean once again with a cleanser, hydrate with moisturizer, and apply sunscreen. Aftercare for 48 hours, avoid chemical peels, scrubs, waxing, heavy sweating, pools and saunas, as well as retinoids. Always use a non-irritating moisturizer, SPF 30 plus sunscreen at least, hydrating serum, and then roundabout you can repeat it every 4 to 6 weeks as needed. Complications, though uncommon, they include cuts, dryness, minor erythema, folliculitis, and acne flare or herpes reactivation, and post-inflammatory hyperpigmentation or PIH. We get similar treatments, as you can see there, with our skin exfoliation depth. Shaving only does the surface. Dermaplaning gets to your dermis. It's your vellus hair and your upper dead skin layer. Then you get microdermabrasion, which is essentially a more robust dermaplaning. And then you get dermabrasion, which is a medical procedure that needs specialist use. So in conclusion, dermaplaning is a superficial manual exfoliation technique that removes dead skin cells and vellus hair. It helps skin appear brighter, smoother, and improves product application and efficacy. It has high rates of satisfaction when done correctly, safe for all Fitzpatrick skin types, and with proper patient selection, sterile technique, and post-procedure sun protection, you will be good to go. Dermaplaning can complement other aesthetic treatments, but does not replace procedures designed for collagen remodeling or deep scar treatment. Thank you very much. We will see you in the next lecture.